Welcome to the Doctoring Differently podcast. I'm Dr. Naomi Lawrence-Reid, your host, a pediatrician, and creator of the Doctoring Differently Academy, where I teach physicians how to explore satisfying, flexible, and lucrative careers beyond full-time clinical medicine. For more information, visit doctoringdifferently.com. Today, I'm joined by Dr. Alannah Mack, a fellow at UCLA Biodesign, where she's designing novel and innovative solutions to tackle some of healthcare's most challenging clinical needs. Dr. Mack earned her medical degree and her MBA from the Howard University School of Medicine. I'm excited to talk to Dr. Mack and all of the guests on the podcast who are creating their own paths in medicine. Subscribe to the podcast on Spotify, Apple Podcasts, or wherever you get your podcasts. And subscribe to the Doctoring Differently YouTube channel to watch all of the episodes on YouTube. And now for my conversation with Dr. Alannah Mack. Dr. Mack, happy to have you on the podcast today. Welcome.
Hi, thanks for having me.
You're so welcome. When I met you and discovered what you did in the world of biodesign, as you know, I could not walk away without getting you to agree to come on the podcast, so I appreciate it. Can you start with describing for our listeners, what is the field of biodesign?
Yeah, absolutely. Biodesign is the field of creating new and novel technologies in healthcare. It's a whole process, but it starts off by finding unmet needs within the healthcare system and then creating solutions, which can be hardware, software, medical devices, to tackle the challenges of those unmet needs.
That is so interesting. And we are going to circle back to the field of biodesign and what you're working on. But you graduated from medical school in 2022, and you decided to not do a residency. Can you talk about your reasoning or decision making to not pursue a residency at the time?
Yeah. Well, I definitely went into medical school thinking I was going to take the traditional path of doing residency afterwards. But I was actually dual degree at Howard. I did an MD, MBA program. I did my MBA in between second and third year. So before doing any clinical rotations, I'd already gotten a taste of business and was thinking about the healthcare landscape a lot differently and how I saw myself fitting into that a lot differently. And so I actually went into my third year rotation saying to everyone that asked me what I was interested in, I'm not going to be pursuing residency. But over the course of third year, things got confusing. Just being in the hospital all the time, right. Being back amongst my colleagues, attendings, sure. Just spending so much time in the world of medicine. Mm-hmm. I mean, things got confusing.
Got it. So you're back in the world of clinical medicine, we'll say.
Clinical medicine.
And really in the hottest cauldron of, end of third year, in third year doing your rotations. Okay, so you started to think,
this is also during COVID.
Oh my goodness, it is during COVID. Where were you in 2020? What year in medical school?
So 2020, I was finishing up my last semester of my MBA.
Okay.
And then fall 2020, I was back doing rotations, or summer 2020, July, I was back in the hospital doing rotations.
Wow. And you were in DC, so you were on the East Coast and really feeling it. Okay. All right. So then you ended up applying to match at that point?
I did. I applied. I kind of bargained with myself. So I was going to apply for internal medicine prelim year. I'll do 1 year just to say I did it. I can be licensed.
Okay.
And then I was going to go on to pursue some other type of life, but it wasn't going to be traditional clinical medicine.
Okay.
And so I matched into a prelim year. But between graduation and July 1st, I mean, it really just wasn't on my heart to pursue it. Okay. I was dreading it so much. And I felt like, well, why am I waiting a year to pursue my dream life? I should just start this now. And so that's when I made a hard pivot to innovation, healthcare, and technology. Okay. And I'm loving life. I've been loving life ever since.
Wow, that was a really courageous decision. It would have been so easy to just trot on the, worn path laid out for all of us as medical students and just let me do the 1 year. Okay, let me just get board certified. Okay, let me just get a clinical job and start down the tunnel, I'll say, of clinical medicine. But so few actually can see and envision a different life for themselves so soon and so early. So I applaud you for that. So, okay, so it sounds like July 1st comes. You've said, okay, this prelim year is not going to happen for me. So what did you do then?
And so then I started trying to figure out, what am I going to do? I was a non-traditional medical student in that I had worked before medical school.
Right.
I worked for Cigna Healthcare.
Oh,
So I had some healthcare business experience before medical school, and then I had this business degree. I was interested in technology and startups. So I was looking into maybe I can do some jobs within that. But nothing stood out for me. And I was just really serious about living my dream life during this time. Right after medical school, I actually had some health issues myself. And I just really wasn't willing to compromise on the dream life thing.
okay. Well, okay. I have to ask, what was your vision of your dream life?
Nothing specific at that time, but it was just doing what I want to do, and being inspired by whatever, I don't know,
Yeah.
like vision that was.
Okay.
I didn't really have anything specific. It was just like, I only want to do what I want to do. I don't want to do anything I don't want to do, because that would be putting myself back in the same situation of going to residency. Like, I could very easily get a job in consulting or health insurance or doing something. But if it's not 100% what I want to do, I might as well just do my intern year. It's all the same.
Sure. And there is definitely no right answer to what is your dream life. That is going to be different for, I hope different for almost every single person. But the core tenets of a dream life likely include, a flexible, autonomous schedule, one you control, a significant income that you can negotiate, and quite frankly, control of the trajectory of your career. I would imagine those are the things, or at least I'll say those are the tenets of my dream career. I don't want to project, but I would imagine they're similar for many people and, of course, many doctors.
And for me, I at this time in my life, I started to think more about like Maslow's hierarchy of needs, and just that pursuit of self-actualization. Like, whatever was going to help me get closer to that is the right answer. And if it wasn't going to help me pursue my own self-actualization, I probably shouldn't be wasting my life doing that.
Okay, that is a very evolved mindset, I will tell you, because I'll say medical education, they actively discourage that kind of in most of us.
Absolutely. Yeah, they do.
Okay. Yeah, they do. All right. So you're a fellow in biodesign, and it's likely that many physician listeners have never heard of this field. How did you even discover this fellowship? It looks like you were looking for it. You definitely had you had some breadcrumbs of where you wanted to go, but really, how did you discover this field and this fellowship?
Frantic Google searching.
Wow.
Trying to figure out what I was going to do. Even though I decided not to pursue residency, I knew I didn't want to go straight into industry. I did want to try to find some other form of training to get the knowledge that I would need to move forward in the life that I wanted to live, which I've always been really interested in startups. I see myself maybe being a serial entrepreneur in the health tech or startup space. So I wanted to get smart on that. And doing other research into opportunities for physicians to do fellowships without residency training. And from that went down a rabbit hole. Okay, well, there's fellowships that are available if you don't do residency. I wonder if there's one in healthcare technology, or I wonder if there's one in design thinking in healthcare. And so it was just like putting different combinations of words together in Google searches until I found biodesign.
Okay. I love it. Some tenacious searching of just, I'm going to be creative and find the thing that I want. Great. So you found this fellowship. Can you describe it, or who's around you, and what kinds of things are you doing?
It's a multidisciplinary fellowship. So it's not just clinicians, and even amongst the clinicians, there's doctors, residents, fellows, a few nurses,
Mm.
but also engineers, those who are pursuing PhDs in engineering, some MBA students, design thinkers, and they put us all together on a team so that we have all the components necessary to bring forth something new in healthcare.
Wow. So can you describe a typical day in your fellowship?
Yeah, it varies, to be honest. The fellowship is kind of broken up into, I wouldn't say quarters, but just time frames.
Uh-huh.
Um, and going along with the design thinking process, the biodesign process.
Mm-hmm.
But our first few months were clinical immersion. So I'm at UCLA as a biodesign fellow. And so my cohort and myself had access to Ronald Reagan Hospital. Our focus was cardiovascular critical care. So we could round in the CCU,
Mm-hmm.
CCICU, we were in the cath lab, we were in the OR, and we're just there to be flies on the wall, observing, typical care.
Mm-hmm.
And as we're observing that, we're looking for, um, things that could be optimized,
Mm.
things that may be challenging. We're interviewing stakeholders, providers, patients, their families to understand their experiences. And so that's like the first portion of uh, the fellowship experience. And each day we're collecting these need statements
Mm.
of potential
Mm-hmm.
areas that we can improve with innovation.
I'm curious, what did you find in the cardiothoracic space, or in this, CCU and the cath lab? What kind of innovations did you imagine coming out of that project?
I mean, there's potential for so much.
Uh-huh.
Our observations went really macro to really super micro.
Okay.
Like anything is something that could be potential for innovation.
Sure.
So when we're rounding with like speech language pathology team
Mm-hmm.
and we get to a room and PT is already there or the patient isn't in the room at bedside, so now they have to coordinate their care for the day. Like that's a potential
Mm-hmm.
need because it's not very efficient for the providers,
Mm-hmm.
and it's not really great scheduling. So that's something that we thought about. We thought about translation services, like
Yeah.
in the cath lab,
Yeah.
the providers are trying to speak Spanish to patients and they're not Spanish speakers themselves as providers. Like that's
Right.
not really that great.
No, it's not.
Um,
Okay.
Down to, I don't know, just so many different things. I
Okay.
can't think of any off the top of my head that are more
Sure.
medical device or med tech focused.
Sure. I'll say, as a clinician, it's so easy for many of us. We kind of grumble and complain about what the tools we're using, or the flows, the system flows, but I recognize that we are sometimes actively kept away from the tables where the decisions are made, where the products are made. And so it's refreshing to hear that there is a path for clinicians to be part of the innovation that can improve clinical care, the delivery of care, the quality of life for physicians, the quality of life for our patients. And this
Yeah.
sounds like this is how it's happening. Can you describe a couple? I think you're working on some other projects. What else are you working on?
So in 2022, when I decided not to do residency, I actually started my own company at that time called Dr. Flow. And we're replacing patient intake paperwork in the outpatient space with culturally competent pre-appointment conversations.
Okay.
And so I've been working on that for the last 2 years. I've been involved in quite a few startup accelerators with that project. I was a prize winner in Pharrell Williams' Black Ambition Prize. So I've had a lot of fun working on that. And then I'm also working on an innovation to the asthma inhaler, a smart emergency asthma inhaler for pediatrics with a UCLA nurse who's also a biodesign fellow.
Wow. And congratulations on that winning that grand prize, that's important. Great job. And as a
Super
pediatrician,
great.
I have to ask, can you describe this emergency asthma inhaler? Asthma is obviously a core of what I do and what pediatricians often talk about and manage. So what is the inhaler?
We're trying to put together a few different technologies, and we're actually working on that novel component right now. But bringing verbal cues and also sensors, mouthpiece sensors, to the inhaler actuator.
Okay.
But we're trying to create like an AED for cardiac rescue or
Oh.
respiratory rescue. So something that is going to improve the technique of
Uh-huh.
an asthma inhaler and also allow any person to administer an inhaler, starting with pediatrics, but we see bigger vision for anyone
Right.
in emergency situations because I'm sure you're aware, California just passed an assembly bill that is going to require public schools to stock emergency inhalers due to a few of the recent fatalities of students
Wow.
who have asthma and didn't have access to their inhaler, or the inhaler was expired,
Uh-huh.
or all of these different scenarios. We're hoping we can solve that.
And you've alluded to a great point in terms of policy in places of Congress, of the Assembly, of local government. I recently interviewed Dr. Annie Andrews, who's a pediatrician in South Carolina who ran for Congress. And she talks about, being mobilized to action. And rather than, as many physicians are, we've been trained to put our heads down, just do the work, just see the patients, but looking up and recognizing that it's policy decisions like the one you've just described. And there is so much room and space for policy across the board that keeps children safe, that keeps Americans safe. And we need to be the ones at the forefront, pushing for it. So I imagine that there were a number of pediatricians and physicians pushing that legislation through here in the state of California. So that's excellent.
I'm sure.
Yeah.
One thing to add is physicians also need to be advocating for themselves, like not just out there advocating for the patients and for good healthcare experience for patients, but a good healthcare and working experience for themselves. I feel like that's not done or talked about at all.
Well, here at Doctoring Differently, we sure are talking about it, but you are a great example. You definitely are a great example of, early in your career, deciding the life you wanted to live and doing that. I recently heard a quote from Coco Chanel, and I believe she said something like, I decided who I wanted to be, and that's who I am. And that belief that, I can be who I want to be. This life is not passive. This career is not passive. This is a choice. Every step is a choice. And I'm not just riding a wave. I actually have a paddle in my hand. In fact, I have a motor in my boat, and I can go and do what I want, where I want, when I want to do it. And I can create my own unconventional path in this career.
Yeah, get out your sail. I was somewhere yesterday and there was a Mark Twain quote, which I'm going to butcher.
I love a quote. Let's hear
it. But it had something to do with like, just get out your sail and like go where you want to go. Live life, discover, explore.
Yeah. Yes. But I mean, again, I can't understate. Most of my listeners are physicians who have taken conventional paths, which we need. Clinical medicine is likely the reason most of us went into medicine, to see patients, to touch patients, to treat them, and to have that relationship, except that many of us, imagined our dream career was waiting in that space, except we found that probably wasn't the case once we arrived, and we didn't have the schedule or the autonomy or the income or the disposable income that we thought we would as a result. But at the same time, maybe your sail was down, your rudder was turned around the wrong way, your motor was off, but all of those things can be changed, and you still can move your life in the direction you want it to go.
I agree.
Okay. All right. More with Dr. Alannah Mack when we're back. We're back with Dr. Alannah Mack, who is a biodesign fellow at UCLA. And we just had a nice discussion about choosing the path that you want and choosing your career and the life you want to live from wherever you are. And Dr. Mack, you alluded to maybe there's a little bit of serendipity also involved in that process. What did you mean?
I mean, definitely I had to make a choice, right? Like I had to decide I'm no longer going to be on this path. I'm getting off this train. Like, I'm not even at the train stop, but I'm just jumping off and like seeing what happens.
Okay.
So that was an active decision.
Sure.
But for me and my journey, especially when it comes to my personal startup and even being a biodesign fellow, it seems like it's a mixture of both action and luck, like action and serendipity. Because once I chose to be on this path, I feel like things have just happened.
Yeah.
Like it seems to snowball, like positive opportunities and things have just, sometimes I feel like they're snowballing out of control.
Okay.
So it's a little bit of both.
Sure.
But after making that initial choice, to be honest, I don't feel like I've had to like will any of this stuff into happening. A lot has just happened on its own, to be honest.
So it sounds like you set the pieces in motion, if I can maybe paraphrase what you've just said, because I say this to physicians a lot. First of all, inertia is an incredibly powerful force. Bodies at rest tend to stay. And once you're kind of nestled into a career, whether you're happy or not, the circumstances around you may make you feel like you can't leave. There's nothing else you can do. You've kind of just got to roll with the punches and take the cards you've been dealt at that point. However, what you're saying, I often say as well, it's just taking those steps. You can't have all of the pieces lined up like that. I bet there are things happening in your life and in your startup that you couldn't have predicted when you started, but you knew that even that starting puts you in the path, right? And so you're a few steps in, you're maybe 10, 20, 100 steps in, and now you're making connections and learning about things you never would have learned about from the starting line had you not even started. Would you agree?
Sure. Definitely.
Okay.
Yeah, I mean, within a year of starting my startup, so 2022, I started my startup. Almost a year to the date, I secured my first funding.
Wow.
And at that, I have Pharrell Williams on my cap table. Like, I would have never guessed that, but it happened.
It sure did.
Anything is possible.
Anything really is possible. Anything truly is possible at the beginning of your physician career, in the middle, at the end, at retirement. There's always a path from where you are to where you want to be. I do have a question about at least the things you're designing in your fellowship, because you absolutely sound like you are destined for big and great things. But I was curious about the ownership of the things you're developing. Are they the property of UCLA, or are you a part of any, patent applications? How does that work?
That's a great question. It's something that I'm trying to get some visibility and clarity into myself.
Okay.
Especially now that my fellowship is coming to an end here shortly. Right now, we don't have any patents.
Okay.
We haven't disclosed any technology.
Okay.
For some of the projects that I'm working on, like the asthma inhaler, I'm working with some PhDs and bioengineering undergrads. For that, I imagine the IP will be UCLA's, because that will continue to be built and prototyped in UCLA labs and using their resources, which is great. It's actually nice to have that opportunity. For my own startup, I started that before I got to UCLA. So fortunately, that's mine. I'm also working on a dynamic scheduler for inpatient care, which is a software solution. And haven't started the conversation on what, if any, IP is available in that, because software is a little bit more challenging to patent versus a hardware.
Okay.
And what that collaboration would look like with UCLA. In particular, if I start building that afterwards. So we don't have a MVP or a minimum viable prototype yet.
Okay.
When I do plan to pilot at UCLA to begin with, it's going to be a manual process. We're not going to bring in the technology yet, and that will come later. So, from my understanding, it's a conversation. Of course, they have their things that are non-negotiable, but go into it thinking that it's a negotiation. And from other people who have licensed their IP back from academic institutions or created IP within institutions, they say that, as long as you go into it knowing that it's a negotiation and have
That's
your
right.
own lawyers and things like that, you'll have better outcome.
That's right. And that is a common theme here on the podcast in any realm is reading your contracts, going into something, knowing what you're signing. And as we discussed, having an idea of your sense of ownership and really every process. But as you said, also, having legal counsel, which, we are told
your own legal counsel.
That's right. That's right. Your own, not
Your own.
not the hospital's lawyers, your lawyer, your own.
UCLA will give me access to counsel. I need my own counsel.
That's as will literally any institution. You are absolutely right. So having your own, and as you said, going into it knowing it's a negotiation, nothing is non-negotiable. Your mind, your skill, your innovation is yours, whether you lend it or loan it to UCLA or any institution or not. And to physicians in the clinical space, whether you're walking into a clinical contract as well, the absolute same tenets apply. It doesn't matter if you are not developing novel technologies or software or medical devices. What you're doing in treating patients absolutely requires, a binding contract that is in our favor as the physician. Okay. So I think I know the answer based on our conversation, but what are your job prospects after fellowship?
I am a health tech innovator. I'm going to continue working on my startup, Dr. Flow, see where that takes me. I recently had this idea because I have so many ideas, like starting a venture studio where I can raise funds to be able to work on all of my ideas under the same umbrella. And so I'm going to be working on that in the next year.
Wow. I'm going to ask this question just for myself because people in your space say words like raise venture and raise money. And to someone like myself, I'm not in that space. What does that mean? If you could give us just a big overview of that fundraising, what does that look like?
There's different forms of fundraising, and it depends on what stage your ventures are at. Usually people start off with like family and friends. So going to them and seeing if they're willing to, invest in whatever you're working on. There's also grants, startup accelerators that you can join that may offer funding. Pitch competitions are another opportunity for funding at earlier stages.
Okay.
And then when you progress into, more maturity in your ventures, then sometimes you have to go to other institutions, which is called institutional funding. So venture capitalists, angel investors, these are people who will give you money for equity investment in your company. And it's a process. It just takes you going out, networking, meeting these people, building relationships with them, pitching your idea to them, and seeing if they're interested.
Right. And networking also generally something that as physicians, we are not, many of us didn't go to business school. I know you did, but, networking is not really a part of our, lexicon of skills. We think, we don't need to network, right? We match, we do our residency, we get a clinical job some way, and then we work. But the networking and talking to other physicians and talking to people, I'll say in and out of medicine, I've made so many connections with people outside of medicine who are not physicians that have opened my eyes in so many remarkable and fascinating ways, because, we are definitely have blinders on. We've talked about that tunnel of medical school of medical education that puts those blinders right on us. And we don't think we can necessarily learn anything, I'll say, from maybe even people of other specialties who are physicians. But some of my most fruitful conversations and inspiring conversations have been with non-physicians in terms of just big picture in the world and how I can make an impact.
Yeah, I think physicians in general could probably use LinkedIn a lot more. Like, I am definitely a LinkedIn girly. I connect with people all the time,
Okay.
and I don't just
Yeah.
connect with them. Like, I'll connect and I'll ask if they have availability for like a 30-minute Zoom chat. Just like introduce myself and see what they're doing, and I can talk a little bit about what I'm doing. And I'm not really looking for anything. I'm just
Wow.
chatting. And from that, I've been able to like meet so many
Oh
people,
my goodness.
be referred to other people. I'll go to conferences and like meet all my LinkedIn friends in IRL. Like,
Mm,
it's so fun.
it is fun. It is fun. I'm going to try that. I too am often on LinkedIn, but I've not tried that strategy of just setting up a call with someone who looks maybe interesting and chatting. That's
Like, literally, why not?
why
Only
not?
maybe twice has someone said, like, no, I don't have time to meet with you. I'm
Okay.
like, okay. But
Yeah.
far more time than not, like,
Sure.
they're very open to just giving you 15, 30 minutes of their time.
Right.
You can learn more about their journey and their story. Um, there's no harm in it.
Got it. So yeah, you introverts listening, just take a deep breath. You can do this too. This is a great way to network. But yeah, you may be thinking, oh my God, what would I say? What can I do? I think as physicians, when I meet many physicians online, they're using aliases, they're using, their dog's
Yeah.
name and their kid's middle name, and they don't want to use a real picture of themselves. They very much are scared of any
Yeah.
repercussions perhaps from their institution if they were to say something incendiary or inflammatory. So, I'm a big fan of physicians. Actually, we need to be seen, we need to be present, we need to be transparent about who we are. And, in this current state of affairs in the United States, I think we need to be the loudest ones in the room, talking science, talking facts, and saying what we believe on every level.
And I think particularly like if you're interested in pursuing something outside of clinical
Sure.
medicine,
Yeah.
that was another thing that I was doing after I made that choice not to do residencies. I was going on LinkedIn and I knew I
Mm.
wanted to do something in healthcare. And so I would just like search like doctors that worked for Google. Like,
Wow.
okay, who works for, let me have a meeting with them. Like, how did you get into this career? You're no longer practicing medicine. What did that
Yes.
look like?
Yes.
Doctors that are working in venture capital, like it's very easy to do those searches for them and just send a quick note like I'm really interested in learning more about what you do
Mm-hmm.
and your career journey, and they're so open to giving you or sharing that information with you. So I think that's a great way to learn about other fields that
Mm-hmm.
doctors are working in outside of the traditional clinical
Clinical. You're
job.
absolutely right. And that is part of my early journey as well. When I left clinical medicine, I did not know what else was out there for physicians, for pediatricians. I thought that we were the most restricted and that we were capped at 18 across the board. And why would anyone else need a pediatrician to do anything else? But as I started discovering different things, I found that doctors were so generous and open with their knowledge. It's how I got into veteran disability. It's how I started doing aesthetics, and doctors were so truly so generous and supportive. And some, gave me real tangible advice or emails of someone who could help. And it clearly has blossomed into a huge venture. So we have so much we can learn from each other. And I again, medical education, I think we're so competitive and so secretive with each other in training. We just are. That's who we come out of college as pre-meds with. We've got to be to even get into medical school, is to just, edge that other person out to get your spot in medical school, or to get that match, or to get that fellowship and job. But I think we need to turn that narrative around in medical school, or in medical training, and around physicians, and network and talk. Thank you for that. Thank you for bringing us down that talk. I love that one. So as we close, Dr. Mack, I'm going to ask you the question I ask all physicians as I wrap. Did this version of your career happen on its own? Did it fall into your lap, or did you have to take some action in order to make it happen?
I had to take some action. But once I took the action, I think it happened on its own.
Mm,
Like once I made the choice, I've really been kind of like on autopilot. Of course, I'm actively working on all of my projects and things like that. But as far as the opportunities that are available to me, and the things that have been happening, I mean, I don't know what the future looks like. I have no idea what's going to happen tomorrow or, this time next year. What am I going to be doing? I'm not really sure, but I know that I'm not actively, willfully, or forcefully making any of these things happen, which is a very different feeling from medical school, where every day I was waking up to like force,
That's right. Yeah.
like by my own will.
Sure.
I was going to make sure I did whatever I had to do that day. Things weren't that easy, but right now I'm rolling downhill.
Okay.
Feels nice.
Okay. I see it. Well, sounds like you definitely took action and made a big step at the beginning. And because of that important step you made, it sounds like the pieces really are falling into place for you otherwise. Can I just ask, where do you see, just think big, talk big, anything, nothing is obviously too big here, but where do you see your career in 10 years?
10 years, I don't know.
Okay.
I live very like day by day, but as I mentioned, I really would like to pursue this venture studio model.
Okay.
Even in speaking to physicians who have ideas and they don't know how to bring them to market, I feel like I could expand that venture studio outside of just my own ideas to helping other physicians who have ideas in technology bring those things to market. So maybe I'll be doing that.
I think
maybe
you
I'll
should.
be in venture capital at that point. Maybe I'll be in angel investing at that point. Hopefully I will have exited one of my companies. And so I'll just be living my dream life. And
That's right.
I don't know.
I think
the dream life part that's happening regardless.
That's happening regardless. And that may change. It may look different at different stages, the dream part, but it will always be yours. And just my personal opinion, I think you can and should do all of them, whether in succession or at the same time, but especially the part about, helping physicians actualize their own dreams of innovation. Yeah. I think that's an important part. But thank you for coming on the podcast. This has been such an amazing conversation. Dr. Alannah Mack, thank you for joining me.
Yeah, thank you for having me.